As South Africa figures out how to make the national health insurance work, the World Economic Forum in Davos, Switzerland, is looking at how governments and the private sector can collaborate to improve access to quality healthcare. Newzroom Afrika's business editor Xolani Mbanjwa caught up with Health Minister Joe Phaahla.
The 54th World Economic Forum is taking place in Davos, Switzerland, and there are many sectors and discussions that are taking place which are quite important in the world we live in today. One such sector that has become ever more prominent since 2020 is the health sector. And I'm joined by our Minister of Health, Dr. Joe Phaahla. Dr. Phaahla, thank you very much for joining us. This week, you will be part of quite an important panel to discuss an important discussion that has been engulfing the world over more so importantly since 2020, and that is a world without antibiotics.
This particular topic of tomorrow on the world without antibiotics, very important because of the fact that we have seen during the COVID that vaccines are important, diagnostic tools are important, but the treatments or therapeutics are also important. And in as much as, if you take COVID as an example, the virus itself was not treatable by antibiotics, but complications which arise as a result of various viruses, including COVID, including HIV, are all needing antibiotics to be treated because the germs which are called bacteria and fungi, which causes disease when a body has been weakened by viruses, can be cured by antibiotics. But the problem now is that with the multiple use of antibiotics, the world has not been very, cautious in terms of protecting these very important therapeutic tools. There are many areas which creates these risks. One of those, just in terms of human use, is that, even medical practitioners sometimes are not very careful about what are the conditions under which antibiotics should be prescribed and leading to resistance. And even sometimes when people just have a simple viral flu, which can be treated symptomatically, then they throw in the antibiotics. But also, just to add that it's multiple because also animals, the veterinarians, but also non-vets, just the prevention of various animal diseases and treatment. Now, what is worse with the animal side is that you don't even require a strict prescription as it is in human treatment with antibiotics. It's much more available, even on the counter for people who've got animals, including cattle, goats, and other, domestic animals. So those are the risks. And then this resistance then cycles around. We excrete some of these products after being taken them for treatment. They get also into plants. We eat the plants, and then the resistance just keep growing. So those are the things which there are a number of forums at the World Health Assembly, at the UN, and we're happy that WEF also has created a necessary forum at which we're going to look at this.
All of what you have just described seems to be needing a lot more money, a lot more investments, and we have people with deep pockets attending here, and they've called you to the room to hear from you. Have they asked you about the national health insurance?
That matter has not yet featured sharply, but I'm quite certain in the topics which are coming in the next 2 days. That matter is going to come because there's a lot of interest, because then the whole world is virtually looking at solutions in terms of making sure that more and more of their populations are covered. And one of the things which was quite high on the agenda in the meeting which I've just come from, is how does government and the private sector collaborate? One, in terms of preventing future pandemics, making sure that, but also making sure that health systems are strong. And that includes making sure that people of the world, whether rich or poor, actually have access to quality health services. Because the recognition in just in this discussion is that it's not enough simply to wait for pandemics and then get together and pull a lot of money, you see, because that is knee-jerk reaction. And what the discussion amongst various role players here was that we need to find a solution where outside emergencies, government and private sector work together to strengthen the health systems.
Before I let you go, Minister, let's talk about what would be your major takeouts at the end of the week.
Well, in brief, what I would like to go away with is where those of us who represent government, who represent the public service of our countries in the health sector, can have a common ground, as we did attempt, and with some successes, not fully so, at the height of the pandemic. This is what some of the participants were discussing. How do we keep the enthusiasm in building a strong health system, sustainable, resilient health system, whereby ourselves as government are motivated to look after our resources, public resources, use them with efficiency, but make sure that there is a common cause with the private sector in investing in more resilient and sustainable health systems. That is really what one is hoping, that through the engagement here, we can again arrive at the common view and mission and vision which we arrived during the pandemic, to say, unless all of us are safe, no one is safe. Now, that should not be only when there's an emergency, public health emergency. But if we could rebuild that common purpose, and you know, when we rise out of this World Economic Forum, have the conviction that we have been able to convince, you know, private sector, you know, players in the health system, that, you know, putting money in health is not just an expenditure, even from the private investors, helping us to build hospitals, to build systems of prevention, including, you know, all the tools, vaccines, medicines, diagnostics, and the entire systems, including health information, and that it doesn't have to be expensive. We accept the fact that as investors, they want to make some profit, but that, you know, knowing that it is in the long-term interest of sustainable economic growth. As a private investors in our health systems, you don't have to charge us an arm and a leg, because what you are investing in is going to help you also to grow your business. So that's the kind of consensus which I hope when we rise from here, we will have strengthened.
Dr. Joe Phaahla, thank you very much for your time, proving that the health sector has become front and center of discussions here at the World Economic Forum, particularly since the advent of COVID-19 in 2020. The world wants a much more preparedness going forward as far as health emergencies are concerned. For Newzroom Afrika on Channel 405, I'm Xolani Mbanjwa in Davos, Switzerland.